I'm going to introduce now Little Presentations, Big Impacts. So there's a lot of great cancer control work going on in Iowa, and to share as much of it with you as possible, we're going to try something new this year. Think of it like speed dating for cancer control programming. We're going to have 5 speakers who are going to spend 5 minutes going through 5 slides. So these are going to be little presentations that show the big impacts these community organizations are making in our states. And while we won't have time for questions, we encourage you to reach out to the speakers to continue the conversations that are started today. And first, we're going to hear from Kerri Johannsen from the Iowa Environmental Council, and I think we'll just maybe have each person introduce themselves just for the sake of time. And Kerri, if you are coming up here, great. Thank you. I think you can push this, but I'm not sure. And it might be a little light.
Thank you. Hello all, my name is Kerri Johannsen. I'm going to figure out this microphone. I'm the Senior Director of Policy and Programs with the Iowa Environmental Council, and I'm here to talk about our Cancer and Environmental Risk Factors project that we launched with the Hartwig Institute in spring of this year. So IEC is a statewide nonprofit organization. We have over 100 other organizations and businesses that are members of ours, and our mission is a just, healthy environment and sustainable future for all Iowans. Let's see if I can make this work.
If that's not, you can try this. Okay, this works, the green button.
Okay, all right. So we launched this project because, as was stated, there are a lot of reasons why Iowa's cancer rates are rising, and there are people doing good work at trying to figure that out. The environment has been the elephant in the room on this topic, and so we want to take some of the sting out of talking about environmental risk factors in Iowa. We want to create space for more discussion about everything that we need to do to reverse this trend, but we have to talk about the environment because a lot of people care about it, and it's something that's really tricky to talk about in the state. Okay. So this project is a partnership, as I stated, with the Hartwig Institute at Drake University, as well as the Iowa Farmers Union. The components include a research and literature review that is due to be published in December, a listening session tour that we did this summer. We went to 15 communities around the state of Iowa. I'll talk a little bit more about that to find out from people what they were thinking and what their community was experiencing in terms of cancer. And then coalition building, campaign, public awareness. There was a lot of conversation here during the last session about what we need to do next to try to really move the ball forward, and that's a role that IEC is really looking to play with our partners. So the results of our listening sessions, what we have done so far. Uh-oh. Okay, thank you. All right, so we visited 15 counties, as I mentioned. We spoke with over 550 folks in these communities. We collected 303 surveys about what people were concerned about in terms of environmental risk factors to learn more about the depth of people, for the people who cared enough to show up at a listening session, what are the things that they are most concerned about? So we got a lot of information from these folks, and that's gonna help guide the research report that we're doing coming out in December. We also received a lot of written reflections, and a class at Drake University is helping us do a detailed qualitative analysis of those results, so we'll know even more about the people who showed up and what they care about. We also took video for folks who wanted to talk more about their own cancer diagnosis, their family's cancer journey, and we see our role also as really helping to share those stories out when we try to elevate issues around cancer in Iowa and look for solutions. One really important part of this process was that the way that we went through these discussions with people, we really focused on helping to build connections within the people who showed up there at the community as well. Many of these folks had not ever talked about their own cancer diagnosis before, especially in a more public place, and helping those community members talk with each other and find new networks of support, as well as starting to build these connections between people that we hope will help us to drive change on this issue in the future were very important. As I mentioned, our public report on environmental risk factors will be coming out. It's actually December 15th, not December 1st here, but the 15th of December is when we plan to release that. And there will be more to come from those listening session learnings as well. And so we're very excited to share those results coming up soon, and happy to talk with anybody more about this project. Thank you.
Okay, and now we have Zuli Garcia from Knock and Drop, Iowa. Okay, there she's coming up. All right. So just push this green button to move it, but there's sometimes a lag. Okay, changed it.
Okay. Hello, everyone. I'm Zuli Garcia, founder of Knock and Drop Iowa and a cervical cancer survivor. I'm also part of Survivor. There are my sisters over there saying hi. Basically, I will tell you that Knock and Drop Iowa was created March 24th of 2020 during the pandemic. I created it, in all honesty, it was selfish. I didn't want to be stuck at home and listening to all the news and not being able to help out. So I created a safe space for the Latino community to come and get food, which is culturally appropriate food. How many of you like, by the raise of hands, tamales, chips and salsa, chips and beans, pupusas, tacos? Well, if you all love our food, what makes you think we don't love our own food, right? And so that's why I created this safe space so people can come and get the food that they need, that they're used to, so children can feel safe, that, you know, they're not just eating the regular canned or box food that other communities are used to. But now we provide wraparound services. We provide educational chats. We started with cervical cancer chats. We do health screenings. We do so many other things, and you can see here in this post, Maria with Council Bluffs, I'm sure she's here somewhere, in Potawatomi, that is one of the pictures there where we had our first cervical cancer chat there with her. We had over 50 people show up. What I do is I believe that your time is valuable just as mine, and so I provide a box of fresh produce for people so they can come and listen to me, but they also get something back, right? A lot of my friends are here from Polk County. I see them here. I work with them all the time. So what I've done is I've gone full head on against the problem. So I contact the local county health departments where I do a cervical cancer chat. And in the rural areas, a lot of the county health departments have come out and they come and provide the HPV vaccines on the spot. So after people listen to my conversation about what I went through, how hard it was for me, how, in all honesty, I'm standing here today and I'm very proud of myself because I was in a very dark hole after I received the news. I really honestly thought that passing away would be the best instead of having my husband deal with all the stuff that I was going to have to go through. And I want to say, you know, Polk County was one of them. Angelica's back there. She was one of the ones that I called right away and I said, I need help. I don't know where to start because I don't know what's going on. I've never had an abnormal pap, and I'm not understanding what's going on here. And she's the one that actually connected me with my survivor sisters, and that's why I'm part of them. And the picture that you see there at the bottom, that was the first cervical cancer chat that we had here in Des Moines. And I remember when I spoke to my mentor at Survivor, she said, how many people do you expect? I said, at least my volunteers, 15 to 20. She's like, that's fine, whatever you have. We had a line of 120 women outside. That told me that I wasn't the only one confused. I wasn't the only one that didn't understand. Now, mind you, I can speak English, I have insurance, I have education. Why am I confused? And I can't even imagine someone that doesn't have the language and things are given to you here. This is what you need to read, and they have no idea what's going on with them, especially with all that you're going through as not only your diagnosis, but also your emotions. I really honestly think that when you give a diagnosis like that, you should have a mental health care provider there, because you have no idea what your mind is telling you to do at that moment. And if I tell you what my mind was telling me to do at that moment, it wasn't good. I wouldn't be standing here today if I wasn't a strong person that was able to tell myself, okay, you got to snap out of it. This is not what you're going to do. And you're going to take this pain and you're going to turn it around and you're going to help others. And that's what we've been doing. And then you'll see the gentleman that's being vaccinated. He was one of the first men that got vaccinated at Marshall County Health Department. And if you understand, in my world, there's a lot of machismo, right? It's a woman problem. It's not a man problem. Well, I'm very blunt. It causes penis cancer. So you might want to do that. And throat cancer, where there's no testing for you till you have a ball like an egg. Right? So, they've been really paying attention, and we've been getting a lot of notices from men that are like, hey, when are you going to have your next chat? I want to be there. I want to get vaccinated. Those are some of the rural area county health departments that have been there, and they have been vaccinating on the spot whenever I do a cervical cancer chat. That's Dallas, Pottawatomie, Marshall, Johnson County. And we just recently went to Montgomery County. And next Wednesday, we're going to have Broadlands. If anybody here is from Broadlands, Shayla, they're going to be there with 20 HPV vaccines for the next cervical cancer chat that we're going to have here in Des Moines for the first time at Knock and Drop. So, those are the things that I feel that we need to work together, because it's one thing when I give the information, their first question is, hey, where do I get vaccinated? How can I get vaccinated? We work very closely with Polk County, and we make appointments with them, or we send them a list of individuals that are, hey, this is their name, this is their phone number. Angelica gives them a call back and schedules appointments with them. But sometimes if we have them there, it makes it much easier, especially because I try to create a one-stop shop. So next Wednesday, what we're going to have, which is going to be a huge event, we have 500 coats to give away to children 0 to 6 years old. We have fresh produce. We have HPV. We have flu vaccines. We have our regular food pantry, and we have a cervical cancer chat. So we're going to have all of that between the hours of 2 and 6 p.m., so that way when someone's coming here, they're getting more than one service. We're not using up their space to go here, to go there, because you have to understand when somebody's struggling, maybe going there makes sense, but then coming here would like to talk to him, but then that costs time, money, gas, and everything. And so the results are amazing. You'll see we have children that have been vaccinated, we have men that have been vaccinated, and definitely women have been vaccinated. One of the stories that we heard, and I want to share this with you, is one of the mothers at one of the consulates that I was at Knock and Drop said to me, before your story, I remember that my husband took my children to get vaccinated, but he only allowed the boys to get the HPV, but he didn't allow the girls to get the HPV. And we were like, really? She said, yeah. Well, why was that? Because he did not want them to sleep around. Because he thought that the HPV vaccine was to sleep around. So the boys could be protected because they can go sleep around, right? Which is really sad that we are thinking that way. And so the way I look at it and I tell them is, you are saving their lives now and in the future. Don't look at it as something that we're not talking about. We're talking about saving lives, because how many have we been told through Polk County and stories that we've shared, there's women, young ladies at 18 years old that have been diagnosed. We've had women that have been told, we can't do anything for you. Sorry, you need to go elsewhere. And we know that Iowa's struggling, right? You don't really have oncologists. Dr. Gonick was my oncologist, and she was amazing. She was an amazing human being. She's an amazing human being because she's helped other women too. but we're struggling. Why don't we prevent the issue instead of waiting till the issue is here? And either A, insurance doesn't want to cover it, or you're fighting with insurance, or there is no help for you. And so those are the stories that we've heard. We have 2 families in Marshall County Health Department that said, when you first started your cervical cancer chat, we didn't know what it was about. And then now our whole family is vaccinated. Like my sisters, my brothers, my nephews, my kids, everyone. So you really do make a difference when you meet people where they're at versus you demanding that they come to you, because sometimes it's a struggle. They want to come, but they may not be able to come. So that's a little bit. I know I didn't go by the points because I like to talk and I like to give my own story. But that's a little bit of what I've done. And, today I have to fly to the NCICP because I'm getting an award. I'm very happy because people are paying attention that we're making a difference and that we're meeting people where they need to be met and not where we want them to meet them. Thank you.
Okay, and now we have Megan Hartwig with the Iowa Cancer Consortium.
That one? Okay, great. Well, good afternoon, everyone. I am Megan Hartwig with the Iowa Cancer Consortium. I am the Rural Outreach Coordinator for the consortium and was the facilitator for the Lung Cancer Screening Learning Collaborative Series, or what we affectionately call LCS2. The Iowa Cancer Consortium is Iowa's statewide comprehensive cancer coalition. A leader in cancer control, the Iowa Cancer Consortium offers the state's cancer stakeholders access to resources, expertise, and non-competitive collaboration across traditional boundaries for a bigger impact in cancer prevention, early detection, treatment, and quality of life. The LCS2 project embraced the collaborative spirit of the Iowa Cancer Consortium. So, in Iowa, only 17% of Iowans who are eligible for lung cancer screening have been screened, and we talked a little bit about why that was. Low-dose CT scan is the standard for lung cancer screening, and it is available in a growing number of communities across Iowa, which allows Iowans access to lung cancer screening within their own communities or closer to home than was previously able to do. Currently, only 24% of lung cancer is diagnosed at the early stage, while late stage is 76%. So the problem becomes, how can we increase the rates of lung cancer screening in Iowa? So the solution was, in partnership with the American Cancer Society, the Iowa Cancer Consortium actually received a grant from the American Cancer Society to host an in-person action planning workshop in November of 2024. And then we had quarterly virtual workshop meetings or virtual meetings to provide the opportunity for follow-up conversations and to learn from different presenters. So you can see here, the photo on the bottom is from our in-person action planning workshop. We had 17 organizations from across Iowa who participated in the workshop. Up over to the side here in the chart is the different sessions that we've held for this collaborative over the last year. So we've had educational sessions. That first one was to help everybody get on the same page. Afterwards, at our quarterly calls, we've had folks from Iowa HHS, from the American Cancer Society, and from the Lung Cancer Screening Network to talk about Lung Cancer Screening Awareness Month, which is coming up in November. Ultimately, at the end of the workshop, the sticky notes that you see on the side of the screen was organizations were asked at the end of the day, what's one thing you can do to get started to put your lung cancer screening program together or to further it. Different organizations were at different places in their screening journey. So some have had screening journeys or lung cancer screening at their organizations for a long time, and others are just getting started. So we had a gamut, and the workshop was really to try and meet people where they were with what they needed in their organization. So we'll actually be closing the formal LCS2 project this November. We'll be doing one more meeting to touch base to see where everyone is at the end of the year on their project. And then we'll be kind of rolling that into some other work groups within the consortium. So again, I'm Megan Hartwig, and my contact information is up on the screen, so feel free to reach out to me if you have any questions about this project, getting lung cancer screening started in your organization, or if you're interested in the rural work group. Thanks. I'm actually going to pass it off to Sarah Juhl now, who's going to be joining us virtually.
Hello, everyone. Can you hear me? Yes. I think I heard a yes. Yes. Okay. So I'm Sarah. I'm the social worker at MercyOne Cancer Center in Waterloo. This here, just a quick, so you guys know who we are. We are through Trinity Health. We are a standalone cancer treatment center as part of the MercyOne programming. We have hematology, medical oncology, and radiation oncology. Unfortunately, we are the only radiation oncology treatment center in the Waterloo Cedar Falls area. So we also perform radiation for a lot of the Unity Point patients. We refer to them as people from down the street because they're down the street from us, that cancer center is. We do have a handful of other services, diet, nutrition, social work, myself, survivorship programming, mental health therapy, a fitness program, as well as a clinical research program. So about a year and a half ago, shortly before I actually started here, so in early March 2024, Kelsey Bagby, who's the former cancer program coordinator, noticed disparities with patients and food, and having appropriate food, appropriate nutritional intake to address while going through cancer treatment. As you know, it is a huge time commitment, sometimes daily, weekly, monthly, for a great period of time. Because of a lot of this commitment and side effects, financial toxicity can become an issue as well. Missing work because of side effects, you're losing your income, possibly your benefits such as FMLA, paid time off, short or long-term disability, or even your actual insurance. So if those things are happening, whether you're cutting hours, that means your finances are becoming more stretched. You still have to pay the rent, the mortgage, the utilities. A lot of times, the thing that gets kind of skimped on is food. So then it kind of turns into, oh, we'll buy the generic, or we'll just, buy some sandwich meat because it's a little bit cheaper, it'll last longer. Again, as we know, with cancer treatment, we need to look more at what we're doing to the body and then what we're putting into the body, whether good or bad. So we're looking at protein, high calorie, along with when we're having GI side effects, as well as taste, swallowing issues. They can all become difficult. As we all know, grocery prices have gone up, as well as if you are having to change your diet a little bit, more specialized things can be sometimes more expensive. So what Kelsey decided was that she wanted to kind of look at food insecurities within the clinic. She wrote up a grant to the Iowa Cancer Consortium and partnered with the Northeast Iowa Food Bank here in Waterloo. The food bank here in Waterloo serves 16 counties throughout Northeast and Central Iowa. So I have a discounted price that I order food from the food bank. I focus a lot on non-perishable foods, packaged meat, soup, vegetables, fruits, rice, beans. We determine this by, I have signs around the building that are asking if you're having difficulty paying or affording your food. or for your family's food. So typically at that point, if they approach staff and say they need food, we always, I talk to them about it. What do we need to do to plan ahead? Is this do you need food stamp type issue? Do you need other assistance? And then I'll get them a couple days worth of food for the whole family. In addition to, I have protein drinks, I have protein powders, things like that. I can also refer to dietitians if we need that. And we have a lot of nutritional education that's provided by our dietitian, but also I have several resources from the American Cancer Society and Leukemia and Lymphoma Society to provide to patients. So once we got things up and running, it took a little bit of time, lots of red tape for contracts and money. But once I started getting food and giving it out, I assisted 29 households that had a total of 54 individuals. 12 of those individuals were under the age of 18. 11 of those households were already receiving SNAP or food stamp benefits. And that was approximately 450 pounds of food. So what is important for me as a social worker, especially to look at, is I don't always look at the vast number and I'm, getting more and more and more. If I made a difference for one family, one individual, one household, that's what makes a difference to me. And if you look at 54 individuals were able to eat a meal or a few meals and better care for themselves undergoing cancer treatment, that matters to me. So, lastly, like I said, I wanted to make sure I thank Kelsey Bagby, who started this program. She's no longer with MercyOne, but I also want to thank the Iowa Cancer Consortium for working with us while we were struggling with the red tape in our company. And I really appreciate you having myself and all of us here today to speak. Thank you.
Thank you, Sarah. And our next speaker is Abbey Loughman with Wings of Hope Cancer Support Center. And this is the last speaker. And then I have a few quick announcements once she's done. So thanks, Abbey. Where is Abbey? Oh, there you are. Thanks. Sometimes there's a lag on here.
Oh, excellent. Thank you. Hi, everybody. My name is Abbey Loughman, and I am the Executive Director at Wings of Hope Cancer Support Center in Council Bluffs, Iowa. So we primarily serve Southwest Iowa, a few in the Omaha Metro, but we have served over 22 counties across the United States this year alone. So we are kind of broad. This is me and my team, and we are small but mighty. We have a licensed mental health practitioner on staff. We have a doctor who's researching the care partner, the issues with care partners and how they can be supported throughout cancer treatment. So yeah, we are, like I said, we're pretty small, but we've been around for 31 years and we've been serving thousands and thousands of cancer patients in Southwest Iowa and are very happy that everyone that's here is doing the work that you're doing. So the problem, I think we can all agree that cancer is the problem. But the three things that we talk about a lot as a mental health organization is emotional isolation, the stigma around asking for help, and then, of course, the care partner strain. So as we all know, when someone gets cancer, there's a ripple effect that happens to everyone in their family and in their social circle, and how do we support them on top of it as well? So the solution. Hold on, I gotta get to my next slide here. So the solution for emotional isolation, now that's kind of been our backbone since we started back in 1994, was you need community. Cancer patients need community, they need people who understand what they're going through, and that validation and acceptance from other people who can understand neuropathy in a different way than someone who hasn't had cancer can. So we've seen a lot of growth and magic happen within our therapy rooms and within our support groups. So that is what our main goal, and then over the years. Things have kind of shifted. So there's a lot of stigma in asking for help. In Southwest Iowa, we serve a lot of rural counties. And I don't know about anyone else who has lived in a rural county. They're not jumping up and down saying, I need help. They are much more likely to kind of sit with that and gravel with that on their own. So all of our messaging that we have that goes out is really, and actually something that I would love to ask all of you to do as well, is to have the conversation of, are you okay? And if you're not, what resources are out there that we can provide people so they don't have to do this alone? There's no point in walking a road this difficult by themselves. And then, of course, the care partner strain. We understand through research that care partners are struggling really deeply right now with the, anticipatory grief of a cancer diagnosis, with trying to navigate having a lot more on your shoulders than you did previously, and also not wanting to burden whoever it is in your life that has cancer by telling them that you're having a hard time. So we hired Dr. Ann Jones this past year, and she just got her doctorates in nursing with research in care partner focus. So we have been working really hard in 2025 to roll out in 2026 a much more in-depth plan to care for not only the cancer patient, but their families. And then the results. I did this before, we're all in quarter 4, so everyone kind of understands this, but I just did my impact report, and I was pretty excited to be able to say that 500 plus connection points was very low. We have talked and touched with over 20, that would be great, 20,000, 1,200 people just this year alone. So we have been making the rounds and going through. We have strategic partnerships with all of the hospitals in both Omaha and Council Bluffs, and a few in the regions or in the counties north and south of us. And then all of our services are free and accessible. We don't ask anybody to provide insurance. We don't ask anyone for a dime. We really genuinely want someone to be able to stumble into our office and get help immediately if they need it. And then the care partner strain. We have started talking to the hospitals to figure out how we can get inside of their spaces so we can meet people where they're at and we can sit with them. A lot of people have someone sitting with them when they're going through treatment. So maybe we provide an educational session to them and let them know about the work that we do. So we partner with a lot of different organizations all throughout Southwest Iowa. Very lucky to be part of the ICC. And yes, we are always looking for more opportunities to grow and partner. So if anything that I said today makes you kind of think, hey, I think we can team up, there's absolutely not a shortage of help that patients need in the state of Iowa. So thank you so much for your time, and talk to maybe some of you soon.